Well, I just want to preface it with saying that I feel very fortunate to be in Washington State, where Senator Jeannie Cole Wells has done so much for cannabis patients. And a couple of years ago, new legislation enabled a broader variety of practitioners to recommend cannabis to patients, and one group was naturopathic physicians, which I was thrilled at because it's a part of our herbal medicine that we have to offer to people anyway. And so I have seen a number of patients using cannabis and recommended to a number of patients. I think there's such a huge range of quality of life improvements that they see. I'm Michelle Sexton, and I'm a naturopathic doctor and clinical cannabis researcher. But actually became fascinated with what is it in a plant that is medicine. And since I knew nothing of chemistry, I didn't know how to understand that. So basically I went and got the education. I was lucky to have a wonderful mentor, Dr. Ellen Peffley at the University of Texas Tech University in Lubbock, Texas. And she introduced me to phytochemicals. I was looking at quercetin content and onions for her. I got interested in native Echinacea to the West Texas plains. Got interested in how do you analyze a plant to find out what's in it. So I just learned it. Did some of that at Bastyr, and then ended up in a research project that was in the lab of Dr. Nephi Stella at the University of Washington, and he studied the endogenous cannabinoid signaling system. And so that's where I've been for 6 years and soaking it up. So kind of that's where life has brought me. In treating people, I like to start on just the lowest level of intervention possible, which is often just asking them about diet and lifestyle. But what's really important is sleep. And it's just amazing to me how many people can't sleep, don't sleep well, don't get adequate sleep, are not rested, and it affects the whole endocrine system in a not positive fashion, really. It can affect weight gain, getting insufficient sleep. It affects your immune system. It affects thereby stress in your body and how you handle stress during your day if you're not well rested. And so, as a matter of quality of life, people report that they can sleep really well and they feel better in general. Therefore, they can get up and function better the next day. So I think that's an important quality of life improvement. I'm very interested in different strains of cannabis, and one of the things that made me really interested is a study I've been doing at the University of Washington, funded by the National Center for Complementary and Alternative Medicine. And so I was looking at the endogenous cannabinoid signaling system in patients with MS, because we know that in the mouse model you can intervene in that system and almost totally prevent disease, shorten its course, lessen its severity. So we think that has strong implications for humans. And many patients report symptom relief, in fact.